doctors scrambling to help. Brain trauma in our troops is an issue that hits home here in the islands. Joining us now is Dr. Cifu. He's a senior TBI specialist with the U.S. Department of Veterans Affairs. Good morning to you.
Good morning.
So this is something that we were talking about earlier. So concussions, can you explain for the person that doesn't know exactly what's going on in the brain, what is a concussion?
A concussion is a simple way of saying a traumatic brain injury. And what does that mean? That means the brain has been traumatized by rapid acceleration and then deacceleration. It's gone from start to stop. It's hit the ground in a playing field, in the battlefield. You got knocked into a wall. That rapid movement of the head causes small areas of stretching of the brain tissues and the white matter, and some small areas of bleeding that then damage the brain.
And you're paying attention to this because you're saying this is an issue we need to talk about. Short-term and long-term. Tell us about how this impacts our lives if we do have a concussion.
Sure. There are about 4 million concussions in this country a year. There are about 250,000 in the Iraq and Afghanistan wars. They occur every day in the NFL and NHL and the battlefield and in other playing fields. So these are common things. What happens right away is you get a period of confusion. Sometimes that's accompanied by headaches, dizziness, sometimes difficulty with remembering things. That can then progress on, if it doesn't get better in about a week or two, to problems with sleep, to problems with irritability, to problems with being able to go back to work, to interact well with your families. And in very extreme cases, which is what we're studying, it may even lead to dementias over time, which is a very scary thought.
And you're reaching out to veterans and families of veterans that are watching that want to help. Tell us about how they can do so and how they can learn more about our troops and helping their health long term.
Yeah, I mean, the military and the VA is very focused on making sure that our troops are well taken care of when these things occur, but also long term. So what can families and veterans do? If they believe that they've had these problems, whether they occurred in a conflict or whether they occur on an athletic field or just in the home, if you slipped and fell, come in and see your professional. See your primary care provider. That primary care provider will then refer you to a brain injury specialist, which exists in the VA, in the military, exists in the private sector. That person can assess you. Most likely you're going to do wonderfully. They're going to give you some good information, make you feel good, make you feel good about how you're going to do, teach you some simple tricks, but then follow you long term if you need.
Perfect. Dr. Cifu, you can, of course, you can hear from Dr. Cifu tomorrow, 1:30. Tell us where this will be.
It's at the John A. Burns School of Medicine, University of Hawaii. It's in the main auditorium there.
Perfect. Thank you so much for joining us this morning, educating us on brain health, really, this morning. Thanks so much.
You're welcome.
All right, you're watching KITV4 Morning News. Your top morning headlines coming up after the break.